This is probably the most important part of this section. The other stuff we're going to review, and it's relevant and it's going to come back again and again, but not in the same way that anatomical terminology is going to come about. A big part of this course is to get you comfortable with using anatomical terminology and hearing from others who are using anatomical terminology. So we start with the classic anatomical position, which means standing erect, facing forward, your limbs at your side, your arms at your side, and your palms facing forward. That's the relative position. So when we talk about anatomical terminology, you're making the assumption that the person you're talking about is in this position. And as I mentioned in Monday's lecture, this is related to the fact that a lot of the information we have from anatomical studies is from cadaver dissection, and this is the position a cadaver would be when placed on the slab. So we've got some terms of relative position, and when we say relative position, you need to think that it's two things at the same time. You don't have one thing that is superior. It has to be superior to something else. So we've got superior for above, inferior for below. Anterior, also ventral, is toward the front. Remember the ventral cavities. Posterior or dorsal, and again, the dorsal cavity is toward the back. Speaking of dorsal, I like to remember this because I don't know if I was a fan of Jaws when I was a kid. I was probably young enough to be scared of sharks at that point. But that fin that goes through the water when you know there's a shark around is the dorsal fin. It's on the back of that shark. Medial means toward the midline. Lateral means away from the midline. Bilateral means there's a pair of structures, one on each side. So we are bilateral with many of our structures. We have arms on both sides. Our face is bilaterally divided. Lungs on one on each side. Ipsilateral means in the same direction. Contralateral means the opposite side. We'll get into those when we talk about reflexes. Proximal means close to the point of attachment to the trunk, and distal means further away from the attachment to the trunk. Again, with proximal and distal, it's really important that you remember you're talking about two different structures. So your wrist can be distal to your elbow, but your elbow is going to be proximal to your fingers. Superficial means close to the body surface, while deep means more internal. That's not too hard. So here we've got the midline defined. We've got right, left, lateral, medial, proximal, distal below. And it's also important that I remind you that when you talk about left and right, you talk about the patient's left and right, not your left and right. So what's on your left side is the right side of your subject. And for nurses, that's usually patients. So there are sections and planes, and sections and planes used to be really a big deal about what the difference was, but with modern imaging, it's become possible to have planes that look like sections. So in any event, a plane is traditionally an axis you could cut on, and a section is an axis that you did cut on. So a sagittal section would be a longitudinal cut that divided the body into left and right portions. Mid-sagittal or median section would divide the body or the subject in two equal halves. Parasagittal would be one side or the other of the midline, giving you unequal halves on the left and right portion. A transverse or horizontal section would divide the body into upper and lower portions, superior and inferior. A coronal or frontal section is a longitudinal cut that divides the body into the anterior and posterior portions, the front and the back. Some of these are going to come up relatively quickly when we start talking about the brain and parts of the skull. We will have coronal sutures, transverse sutures. So it's good to know them. And here they are demonstrated with sections. And this is a good example. Here is an x-ray, it looks like, that is actually plain because there was no actual cut made in traditional speak, but your image is a frontal section. And again, here looks like an MRI, perhaps, with a transverse section, or I'm not sure what kind of scan it was. So we can do the same thing with tissues and organs. You can go all the way down to histological sections. We could have a sagittal section, a transverse section, or a frontal section. We'll look at these in the lab as well. In cylindrical organs, you can have a cross section, an oblique section, a longitudinal section, blood vessels, ureter, trachea, the intestines, and you can have these same kind of sections in organs that are not cylindrical as well. You can take a cross section of the liver, an oblique section of the liver, or a longitudinal section of the liver. So we talked a little bit about body quadrants. Most of us in the health profession are perfectly able to use the 4-quadrant method. So we have an upper right quadrant, upper left quadrant, lower right quadrant, and lower left quadrant. And by describing symptoms and signs within those 4 regions, it will give you an idea of what might be involved in case of pathology. If you were an anatomist, professional anatomist, or if you were an abdominal surgeon, or worked for an abdominal surgeon, for those of you nursing going into the operating room, you probably need to know the more detailed 9 region, which would be the right hypochondriac, epigastric, and left hypochondriac. And hypochondriac here means below the ribs. Epigastric means around the stomach. The right lateral, umbilical, and left lateral. The umbilical is around your belly button, and to either side of that is the lateral. Below that, you would have the right inguinal, the pubic, and the left inguinal. And the inguinal refers to structures that are found within those abdominal regions. But for most healthcare professionals, particularly nursing and emergency medical emergency medical providers, the 4-quadrant is used most widely. All right, so that covers up Chapter 1, finishes up Chapter 1, I guess. These videos are all posted. Watch them. Do your homework assignments afterwards. Your test questions will come from your homework assignments.